Hi everyone, my name is Navin. Welcome back to my YouTube channel. Okay, today I'm going to explain you all about my assignment topic, skin transplantation, which is also called as skin grafting. Okay, what is skin transplantation? Okay, skin transplantation or skin grafting is a type of graft surgery. Involves the transplantation of skin. The transplanted tissue is called a skin graft. It is a surgical procedure that involves removing skin from one area of the body and moving it or transplanting it to a different area of the body. This surgery may be done if a part of your body has lost its protective covering of skin due to burns, injury, or illness. Skin grafting often takes place after serious injuries when some of the body skin is damaged. Surgical removal or excision or debridement of the damaged skin is followed by the skin grafting. The grafting serves two purposes, which is reducing the cost of the treatment needed and the time in the hospital, and also improving the functions and appearance of the area of the body which receives the skin graft. So now let's see what are the types of skin transplantation. There are two types of skin transplantation or skin grafting: split thickness grafts and full thickness grafts. Let's see about split thickness graft. Split thickness graft involves removing the top layer of the skin, which is the epidermis, as well as a portion of the deeper layer of the skin called the dermis. These layers are taken from the donor site, which is the area where the healthy skin is located. Split thickness skin grafts are usually harvested from the front or outer thigh, abdomen, buttocks, or back. Now let's see full thickness grafts. Full thickness grafts involves removing all of the epidermis and the dermis from the donor site. These are usually taken from the abdomen, groin, forearm, or area above the clavicle, which is also called as collarbone. They tend to be smaller pieces of skin, as the donor site from where it's harvested is usually pulled together and closed in a straight line incision with stitches or staples. Okay, now why a skin transplant is done? A skin graft is placed over an area of the body where skin has been lost. Common reasons for a skin graft include skin infections, deep burns, large open wounds, bad sores, or other ulcers on the skin that haven't healed well. Skin cancer surgery also will be the cause for skin transplant. Okay, now how to prepare for a skin grafting? Means for skin transplantation. The doctor will likely schedule skin graft several weeks in advance so that the patient will have time to plan for the surgery. Patient must inform doctor ahead of the time above any prescription. About any prescription or over-the-counter medication they are taking. Certain medicines such as aspirin can interfere with the blood's ability to form clots. The doctor may instruct to change the dosage or to stop taking this medication before the surgery so that the surgery can be done in a better way. Additionally, smoking or tobacco products will impair the ability to heal the skin graft. So the doctor will likely ask to stop smoking ahead of the surgery. So smoking and tobacco also can cause it can cause the ability to heal the skin graft to be impaired. So that one have to be avoided before the surgery. The doctor will also tell not to eat or drink anything after midnight on the day of the procedure. This is to prevent from vomiting and choking during the surgery if the anesthesia nauseates. The patient should also plan on bringing a family member or friend who can drive them home after the surgery. General anesthesia may make you drowsy after the procedure. So the patient shouldn't drive until the effects are fully worn out. because it can cause accident. It is also a good idea to have someone stay with for the few days after the surgery. The patient may need help performing certain tasks and getting around the house. So the patient cannot be like doing their household chores like normally for a few months until the skin grafting is fully covered. Okay, now let's see the procedure of the skin transplantation. A surgeon will begin the operation by removing skin from the donor site. If you are getting a split thickness graft, the skin will be removed from an area of your body that's usually hidden by clothing, such as your hip or the outside of your thigh. If you are getting a full thickness graft, preferred donor sites are the abdomen, groin, forearm, or area above the clavicle or collarbone. Once skin is removed from the donor site, the surgeon will carefully place it over the transplant area and secure it with a surgical dressing, staples or stitches. If it's a split thickness graft, it may be meshed. The doctors may punch multiple holes in the graft to stretch out the piece of skin so that he or she may harvest less skin from your donor site. This is also allows fluid to drain from under the skin graft. Fluid collection under the graft may cause it to fail. In the long term, the meshing may cause the skin graft to take a fishnet appearance. The doctor also covers the donor area with a dressing that will cover the wound without sticking to it. So this is how a skin transplantation is done. Okay, here are some case of successful and unsuccessful skin transplantation case. So now let's see a successful skin transplantation case. An 83-year-old female presented to a regional health center with a large non-healing ulcer on the anterolateral aspect of her left leg in the context of chronic peripheral edema and venous insufficiency. Biopsy revealed a well-differentiated squamous cell carcinoma (SCC) of 5 mm thickness. Initially, the SCC was treated unsuccessfully with antibiotics and topical 5-fluorouracil. Following treatment failure, the patient was consented for definitive excision and split thickness skin grafting (STSG). Preoperatively, the wound developed a foul-smelling odor and clear transudative discharge. Intraoperatively, the lesion was extensively measuring 10 cm in largest diameter. It was subsequently excised with clear microscopic margins. STSG was harvested using a pneumatic dermatome with a large donor graft taken from the ipsilateral upper thigh. The STSG was inset with staples, betadine soaked gauze, and sterile foam and dressed with crepe bandage. Given the lack of clinical or biochemical signs of infections and adequate graft progression, all antibiotics were ceased by post-operative day 4. At time of discharge on post-operative day 21, the graft remained intact with approximately 8% uptake. Upon subsequent review in the outpatient setting, the graft demonstrated complete uptake, which means the skin transplantation is almost success. So these are the pictures of successful skin transplant. The graft remained intact with approximately 8% uptake is on the left hand side, and the graft demonstrated complete uptake is on the right hand side. From these to this. Okay, this is the case of unsuccessful skin transplantation. An 53-year-old Caucasian male smoker with remote history of left lower extremity deep venous thrombosis (DVT) and a strong family history of thrombosis who presented to the Center for Wound Healing at MedStar Georgetown University Hospital with spontaneous left leg ulceration. Prothrombotic evaluation revealed homozygosity for the factor V Leiden FVL mutation. Therapeutic anticoagulation was commenced with warfarin, comodine, and the patient underwent successful debridement and appligraft, followed by split thickness skin graft (STSG) of two wounds. He had an uneventful post-operative course, and on the 27th post-operative day, the grafts were 95% intact. However, by the post-operative day 41, post-operative day of the 41st day, there was 10% graft loss, and over the subsequent 2 weeks, both graft necrosed. On further questioning, it transpired that the patient had discontinued his warfarin on post-operative day 37 because he thought it was no longer necessary. So due to the patients stopping the warfarin, it caused the skin grafts to be necrosed. The mechanism by which prothrombotic states, particularly FVL mutation, can contribute to skin graft failure and delayed wound healing. This case highlights the importance of considering prothrombotic conditions in patients with spontaneous leg ulceration and the impact of therapeutic anticoagulation on healing. So, even though the doctor is not highlight the importance of considering prothrombotic conditions in the patient, the patient also should be taking the warfarin continuously. Due to stopping of warfarin, the wound becomes bigger, and it's not like the skin grafts gets necrosed. So these are the example of the pictures of unsuccessful skin transplantation. On the 27th of post-operative day, the grafts were 95% intact. Intact means it's completed. You can see on the left hand side. On the right hand side, on the 41st post-operative, there was 10% of graft loss. So it becomes bad after he stopped the warfarin. Okay, these are the reference. So that's all from me. If there is any questions, don't hesitate to comment in the comment sections below. Thank you so much for watching my video. Please don't forget to share, like, and comment whatever you thought about this video. And thank you for watching and having your time here. Thank you so much.